Topic is a common question I get. I hear this on the internet, I hear this in my office a lot, I certainly hear this from parents, is when or should my child be under chiropractic care? You know, should they go? Is it something that they need? Is it something that's going to benefit them? So I think I want to start all the way back from the beginning to ask you a question. So I got a few little instruments here and a couple of models to help explain what we're talking about. But here's little baby Joey, okay? So here's our little baby. So I want us to think about for a minute how your child is born. So if we think about a baby being born, even with what we're going to call non-traumatic vaginal birth, the baby coming through is going to get some pressure along the cervix of mother's pelvis, and then as the baby through pressure actually stretches the cervix, you're actually getting a lot of pressure, so we're getting a lot of compression in those areas of the spine, particularly the upper part of your neck. And then what's going to happen is that baby's born, often through the assistance of midwife or an OBGYN, we're going to start to get some pulling pressure on the upper part of the neck, which is then going to cause, again, more pressure at the upper part of the neck. So the big concern is, if you think about it, what type of soft tissue damage is going to occur and what's going to happen to the alignment of these vertebrae in the neck of an infant with that pressure. And in general, that pressure is going to cause misalignment. It's going to cause those vertebrae to get stuck. So if you look at research really from the 1970s forward, we're going to see that through either palpatory, through palpation, through electrical diagnostic testing, through scanning and imaging, we're going to find that 90% of babies or more have misalignment in the upper part of their neck following birth. Some of the research is showing that much of what we see in adulthood, you know, that 30, 40-year-old age or older, often is the result of the trauma that occurred from birth. It kind of goes along with that idea, you know, if some people that are older, you think about, geez, I've got a bad knee, and I injured it 20, 30 years ago, it didn't give me too much trouble till more recently. We'll tend to see that with our spines. So in babies, we tend to see a lot of trauma here. Not only does it affect their health, but it leads to causing problems later in life. So what I've got here is a pediatric spine. So in here, and Bobby Joe's my camera assistant today, what we're going to see is, we're going to see these upper areas of the neck. These vertebrae will shift out of alignment. And you can see here on this model, there's nerves that come out of here. And each one of those nerves, it's kind of like a breaker box in your house, or if you think of like a computer, each one of these wires goes to a different part of the body and has a responsibility to tell that body part what to do. So let's say this is an infant, here's the brain of your child, right? And then here's the spine, and then here's all the organs. So we commonly see a lot of misalignment in the upper part of the neck of an infant, which often leads to disruption of the nerves, which then leads to health problems in that child. So one of the most common reasons to go to a pediatrician is for ear infections, what they call otitis media. So what we know through science is these nerves here tell the eustachian tube, which has muscles in it, to open and close. So when this upper part of the neck is out of alignment, those tubes are not functioning. The middle ear doesn't drain as well. And as a result, the child is much more prone to ear infection. So what we know is if it's out of alignment, it'll cause the child to be more prone to having upper respiratory problems, sinus problems, ear infections, headaches, all as a result of this upper area being out of alignment. So that's certainly one of the areas that we want to evaluate to measure where it's out of alignment and how far it's out of alignment, so we know exactly what we need to do precisely and scientifically to push that vertebrae back in a better position. The other concern, and there's very few births now that aren't using devices, so these aren't as common anymore. These would be a forceps. So we tend to see this a lot in older adults, obviously, that 40, 50-year-old, 80 to 90% of adults have forceps use. So think about what that's doing to your neck and why you potentially have had problems over the years. This is another device that's commonly used now. This would be a vacuum extraction So they're going to use this and they're going to put a suction to the top of the head of the infant, but the same idea is going to happen. It's going to pull in that upper part of the neck, and that's an area of concern. It's delicate. Certainly those vertebrae are going to cause pressure to the nerves. Those nerves are going to be, like I said, affected, and then it's clearly going to cause some health challenges with the child. The other things that we're finding with children when this upper part of the neck is affected is ADD, ADHD. So we're finding that when the nerves are affected, it affects the brainstem, the spinal cord, from processing those messages. We see a lot of children on the spectrum that either have autism or Asperger's syndrome, speech delay, for example, all as a result of these areas in the upper part of the neck being damaged. We can worsen those conditions or certainly contribute to having more problems with sensory integration or other areas that deal with neurologic developmental challenges for a child. So that's why children will benefit greatly from care. The other important point is the child doesn't have to have a health problem to be in need of care. The example I always use is dentistry, for example. So when would you start brushing a child's tooth? You know, as soon as they get a tooth. Not because it has dental disease, but so that it doesn't get sick. So often what you'll see is some of these children will have misalignment that's significant but not severe, and it's actually causing problems in their body that don't allow the body to work as well. And then as years go on, I'll see that child now at 30 or 40 years of age in my office. I take an x-ray and I notice that, hey, they've had problems for decades and it's gotten progressively worse. The other couple questions I get is how often children need care. Traditionally, most children, if the spine is relatively well, they haven't been out of alignment very long. Most children are baby see me monthly, and that is a way to ensure that whatever we're correcting stays in really good alignment and mobility, and the nervous system stays healthy, as well as ensuring no new problems could develop in the spine as well. So we certainly insist through the science showing that there's so much misalignment and trauma to the neck of your child or to the lower back, the pelvis of your child. What science is really showing us is that there's an important significance, really an insistence on checking the child to ensure that they're in good alignment short term to help their health, and then long term so they don't develop so much of what I see as an adult. I mean, I must tell you that 90+% of the adults that I see in my office have so many problems that began decades ago, and it's always heartbreaking because you wish you could have gotten involved as a doctor years earlier so that they never got that sick or damaged as they are now. So hopefully that answers some of your questions. If you have any other additional questions, concerns, time, cost, safety, if you're somebody that maybe would love to bring your child to a chiropractor, and I insist that all of you do, but I'm in Cicero, New York, and I'm not a local for you, by all means, just message me privately or publicly, and I'll make sure that I hook you up with a chiropractor that really focuses on taking wonderful care of your child. I'll tell you, father of 2 boys myself, there's no greater honor than when a parent brings your child into us to get care, to be taken care of. That's something I take very seriously, and I know other doctors out there do the same. So I'd love to see your family being properly taken care of by someone who loves, certainly children, has a lot of experience with that as well. Hey guys, this is Dr. Joe Borio. We do a video every week sharing a little bit more information with you about how we do things in our office. There's a link right above or below. You can give us a call in the office or message us, or you can visit us on our website at boriochiropractic.com, and we'd love to see you and your family in for a checkup, evaluate the spine, find out where you're out of alignment, where you're subluxated, and we'd love the opportunity to take care of you and your family. Have a great week, guys. Yes?